Assalamualaikum everyone, this is Dr. Pasha from KRISALYS Cosmetic Tower. Today we have a very special guest with us and I'm very honored to call Dr. Shahab Mahdi for this podcast. He's a cosmetic plastic surgeon practicing in the UK for the past 25 years and he's also a visiting cosmetic plastic surgeon in Pakistan. Thank you so much, sir, for being a part of this.
It's a great pleasure, Harim. Nice seeing you as well and welcome to you as well at KRISALYS because I've been here a little bit before you. I'm sure you'll enjoy it as well.
Thank you, sir. So, sir, how has your experience been here at the KRISALYS?
I started at KRISALYS almost 2 years now. Previously, as I say, my main practice is in the UK.
Yes,
right?
Sir.
That is where I mainly practice.
Yes,
And let's put it that way, if I have to break down the proportion, 90% of my work is still in the UK, Manchester based
Yes,
primarily.
Sir. Yes, sir.
This is my visiting area. I used to have my own independent clinic in here, but I think the way the things have gone with the market and everything, and especially after the COVID situation, what happened, I realized that working independently, especially for a very short period, was not quite feasible for me.
Yes, sir.
And incidentally, I was approached by KRISALYS, and I just came and visited the setup. I really fell in love with it straight away, so I've not regretted that at all.
That's great, sir. Sir, I would like to ask you something regarding what's going on in the market these days, the medical fraternity. There are a lot of people out there who are not even are doctors and not even licensed, have started doing the practicing cosmetic surgery. So what is your take on that?
Okay, I would just make it a little bit simple. Well, we have to sort of distinguish between cosmetic surgery and aesthetic practice. Okay, when we for cosmetic practice is basically non-surgical.
Yes, sir.
Cosmetic surgery is surgical.
Yes, sir.
I think for surgery, even in the UK, Pakistan, there are very strict regulations as to who can do it. They have to be properly trained.
Yes.
Ideally, a plastic surgeon, which is my background. Or if not, you have to have a lot of training in a specialized operation before you can actually practice it. But the non-cosmetic surgery or non-surgical practice, that's where things are really haywire everywhere in the world. I'm not telling even in the UK. I was talking to one of my colleagues here earlier, who was asking me what's the regulation. Unfortunately, the market even in the UK is very unregulated.
Alright.
Still.
It's still there.
Still, and every time there is a blunder, there's a disaster, the newspaper flashing with all this complication, and then all the time again there's a discussion, we need to regulate the market, who can, who cannot. Still, believe it or not, I had a lot of patients coming to me now for cosmetic surgery. I said, what do you do? I'm an aesthetic practitioner. I said, well, okay, are you a doctor? No. Are you a nurse? No. Are you a beautician? No. How are you doing it? Well, I just went on a course for 1 week. I got a certificate, I'm doing it.
I'm doing it, yes.
And that's what they're doing. So, effectively, I hate to say that even in the UK, you don't need to have any type of a license to do injection botox products, which is really trashy.
Which is very trashy, yes, definitely. So that could risk a lot of people out there. We are risking a lot of lives, we're risking a lot of people out there. Even not even in Pakistan, even in the UK or anywhere else where you are not a doctor and you're practicing such procedures.
Absolutely, and I think the concept people think it's easy money. I think that's what is attracting a lot of people to go into that, but it really isn't.
Yes, it isn't.
It isn't. It's very hard work. You have to have the proper background and you need to be able to handle the complication. Unfortunately, complication is part of
the life, yes.
Surgery, non-surgical, you still get complication. Give a Botox, you give one drop wrong, you can have a brow too high or too low. For example,
yes,
you know what I
definitely.
mean?
There's a lot of multiple cases out
won't be
there.
smart and you can be stuck for 4 months and really there's no way of reversing the Botox.
Yeah,
as far as you know what I mean? You just have to wait.
Yeah.
So, disasters like skin necrosis, etc. And I think it's very important that people only go to qualified people like yourself who are doing these cosmetic practice for a very long time.
Yes, sir.
So I think in some way, at least in Pakistan, people go by the name, they know who the qualified person is. So in some way I hate to say that, I think cosmetic aesthetic practice might be a little bit safer in Pakistan compared to UK at the moment.
Okay, that's a nice thing for our viewers. So you can come to KRISALYS for all your procedures because as Dr. Shahab Mahdi told all of you, it's safe in Pakistan.
Absolutely. I mean, people do a lot of, nowadays, with the social media world, you are like an open book everywhere.
Definitely.
They come and they do a lot of research on you. Everything is there, you know what I mean? And I think, I'm sure people coming to KRISALYS should feel comfortable that somebody like you with a lot of experience and training, they should feel comfortable with all that.
Yes, sir. And at the end of the day, the goal of the KRISALYS is to bring out the best of the people, of the patients that come into us. We would like to boost the confidence of the patients, and we just want them to feel the best in their own skin.
And that's why, going back to your original question, why I was attracted to KRISALYS again,
Yes, sir.
because now, I mean, I've seen the market change, right?
Yes, sir.
I was probably one of the first plastic surgeon who had a fully independent 100% cosmetic practice. And I think people used to tell me how I do to survive in Pakistan or cosmetic practice, because most plastic surgeons, they will 90% reconstructive work, 5 or 10% aesthetic work. But things have obviously changed. I was the first one to introduce what called the word liposuction.
Yeah.
You probably didn't even start training at that time, going back to the year 2000.
Okay.
And it was at that time I did a lot of marketing and advertising and all of things at the time, it was magazine, but it's all changed now.
Yeah.
Patients knew the word liposuction before they knew liposuction.
Yes.
They would go to surgeons, I want liposuction, okay? And that's why that really forced a lot of my colleagues to literally buy those machines in the end of the day.
Yeah.
But as I said, the things have changed. But nowadays, it's like a global practice. I think it's just like a holistic practice. You cannot do like surgical and just ignore the non-surgical side. So they just supplement each other. So I think that's why I feel somebody like you, obviously I can do my surgery on the face.
Yes, sir.
I can take away the excess skin. I cannot rejuvenate the skin. I can send them to you.
Definitely.
For skin hydration, pigmentation, and all those type of things. Exactly. You know what I mean? So it's like people want rejuvenation. It's just not the old concept. Your skin through tight kar diya.
It's not a one-man show.
It's not a one-man, and the patient used to be happy with those things, but
Yes,
now they're not, because the level of expectation is increased a lot as well, because patients are aware of what can be done. So from that point of view, again, is an attraction for me being in a setup where we have pretty much, I'm sure you know exactly what sort of treatment you can offer here, and that supplements my practice as well.
Yes, sir. Sir, what I have been seeing these days, patients out there, they have very unrealistic expectations. They come to us and they're like, we want this certain sort of a figure, we want this certain sort of a physique, we want this certain sort of a face, for example, nose, jawline, whatever. So your practice has been so long, mashallah. So what importance do you feel should be there to break down the unrealistic expectations of the patient?
I think this is a very, very important question, because I think we as qualified people, I think we need to know which patient not to do any procedure on.
Yes, sir.
Patients sometimes develop very unrealistic expectation, and I think we have to manage their expectations.
Yes.
I think managing expectation, try to explain to them what can be done, what can't be done. Obviously, going through the complication and everything, and sometimes they have to prepare them. Sometimes things do go a little bit wrong, but don't worry. If it goes like this, and for example, I'm doing a facelift, I'll run through all sort of complications, and then people say, oh, well, I said the reason I'm running through this complication because partly for you and partly for myself, remind you of the possible complication, what I can do to minimize the risk.
Minimize the risk, yes.
And secondly, if they do happen, what can be done to manage it?
Manage it. So a proper and a good consultation comes.
That's the main thing. And I think, when I get a patient coming in for consultation, literally in 2 minutes I can see exactly what can be done for them.
Yes.
But it's not what I can do, it's what's in their head.
Exactly.
All my consultation, I can spend 1 hour trying to read their mind.
And to convince them.
Convince them or convince myself that I can achieve what they want. And if I feel that their expectation is something which I can't achieve, I'm very happy to say to them, sorry, I think, you should go and see another colleague of mine. And at least I'm very open to let patients go and see other colleagues.
Yes.
And in fact, it's actually very much encouraged, I think,
which is very nice of you.
Second opinion, because alhamdulillah, I'm the stage now. वो ज़माना खत्म हो गया कि patient आ गया उसको you don't let them go anywhere. It's an open market. Let them go, let them do the research, and I said go and see 2 or 3 surgeons. Just see where you're comfortable with. Just go with them. And it's not only that; it's a matter of the patient and the surgeon getting onto the same wavelength. So they both know exactly what is to be achieved and what is to be expected. And it's a matter of what patient wants and what can be done. If we can find a happy medium, then we are in business.
Definitely. So with this question, the other question what I have in my mind is, there's one thing, a doctor, a surgeon, everyone is allowed to say no to the patient if you feel you can't get the desired results.
Yes.
And there's this patient psyche where you feel like no matter what you do for the patient, you can't make them happy. So for you, how important it is for a surgeon, cosmetic surgeon especially, to say no to a patient if you feel like the patient isn't going to be happy after the result, no matter how good it is.
Yeah, because surgery is sort of permanent.
Yes.
The scars, they are permanent scars.
Yes.
Right, okay. I do a lot of breast surgery in the UK, especially. Obviously, if you're doing a lift, a lot of scars, they're permanent scars at the end of the day.
Yeah.
So we need to be sure that the patient understands the benefits against,
The pros and the cons.
Exactly, it's a balancing act, right?
Yes,
okay.
yes.
So, and I think that's what you need to just make sure the patient understand all those things. I show them slide of expected outcome. I show them slide of all the complications, so that they can understand. And I say, listen, this is the thing that happen, and if this happens, this can be done. So I think the main thing is to just prepare the patient, talk to them, and obviously we need to, you heard of body dysmorphia. I mean, luckily it's very rare, but you have to take one wrong patient, you know what I mean, then it is not very pleasant experience at all.
Exactly.
So you need to understand the psychology of the patient. That's very crucial.
It's very important. And the word of mouth travels.
Absolutely.
And one thing again, what I have seen in patients, especially in Pakistan, they never consider where they have gone wrong. Like even in recently I encountered a patient. She wanted a specific surgery. I told her she's not the ideal patient for this surgery, but she keeps on calling you. So the significance of saying no to a patient. I feel you need to have that confidence to tell a patient, I'm sorry, I cannot.
No, I think I was listening to some surgeon. He said the first 10 years I learned how to do the procedures.
Yes, sir.
The next 10 years, I learned how to deliver the results. And for the last 10 years, I know when to say no to the patient.
Okay.
So that's very important. You need to be able to say no to the patient if you think that you cannot achieve what they want. It's not what you can do. I mean, for me, I can see a patient, I can do a fantastic result from my point of view.
Yeah.
Before and after, and I can show the patient. But the patient is not happy, as far as I'm concerned, it's a failed operation.
Failed operation, definitely.
Not because, and there are so many times when we see my results, well, I'm sure it can have been a lot better, but the patient is extremely excited because the level of expectations is exceeded that.
We're really high.
Yeah, so really, once it's all about patient satisfaction. If you can't have a happy patient, then it's a failure.
There's no point.
You can say, oh, look, before and after look great, yes.
Yeah.
But the patient is not happy, it's a failed operation.
Perfect. Okay, Dr. Shahab, what I feel, cosmetic surgery, plastic surgery, aesthetic medicine has grown a lot. The field has been growing immensely. What difference do you feel in the current aesthetic medicine practice, cosmetic plastic surgery practice, and way back?
The way back again, as I say, it was number one, patient didn't know what to expect.
Yes.
जो भी कर दिया result आ गया ठीक है बेहतर हो गया people accepted it, but now because of the social media, the exposure, people talking to each other, patients talk to each other. There are all these women's group. I mean, if something coming about breast implant surgery, for example, they talk to each other, and the way they communicate. In the UK, I give example. Patient आएगी मेरे पास, अच्छा, I've just seen Dr. Shahab Mahdi, such and such. Has anybody else been before? To see him, he's recommended this implant size and this manufacturer, and then suddenly within minutes, before she's there waiting in the waiting room, she sent it out. And hundreds of other sort of patients would be there responding to her, what I mean?
Yeah, I get it.
Basically, most of them luckily good experience, what I mean? But at the end of the day, occasional patients have issues, they experience that, the reviews, feedbacks are there.
Yeah.
So nowadays, we have to be very careful, what I mean? And again, they can compare the results to each other, they talk to each other, they communicate, the level of expectation become very high. And we need to be very, very honest with them.
And being honest, you have to be very, very careful what I feel now.
Yeah.
Because when I'm doing procedures, first of all, the way I work, because you are a senior cosmetic plastic surgeon, I just want to be there, inshallah, where you are. One day, inshallah.
Things happen, yeah.
Inshallah. But still, I feel like I still work. My way of working is like I want to keep myself safe and the patient safe. The safety comes first.
I think that is the most important thing. I think at the end of the day, and I think we've all done it, as a junior doctor or junior surgeon starting training, you're always trying to build your practice,
Yes.
And you
Sometimes
end up taking patients which you're not even comfortable doing with, but alhamdulillah, by the time you reach my stage, you were comfortable saying no to the patient if you think you can't deliver the results. So inshallah, you will get there. I remember when I started my practice, I was very young plastic surgeon. I did a sort of short stint in Saudi Arabia. I mean, I was so young looking and I used to pray to God to give me some grey hair. At least I look like somebody with a bit of experience. I mean, I'm quite proud of my grey hair. I don't put any dye or anything. And because
but you're a very good looking cosmetic
I've
plastic
been
surgeon.
there. I've worked very hard to get those grey hair.
Oh,
you know what I mean?
definitely,
So I don't want to change the color of my hair because to me, that's my experience.
That's
I worked hard for
yes,
that.
definitely.
Yeah.
So, you know what I feel, one thing what's coming in my mind, being someone who, in the field, a lot of senior cosmetic plastic surgeons out there, a lot of seniors in the field, they do not want their, they have this level of insecurity. This is a very controversial question, to be fairly honest, but I would like to, ask it out because I think, I should. So, what do you feel about them? Like, they just don't want their, the junior doctors to learn as much, or I don't know what's
Okay,
there.
I think if I understood your question clearly,
Yeah.
maybe I misunderstood. Let me see. I think when I started, there were, I think in Karachi, I'm talking mainly experience, Professor Faiz Saqi, he was the only
Yes.
senior. Literally, he was the one, the Durrani Saqi, he didn't have a big private practice, Faiz Saqi. One or two people, Dr. Kultalati, they were senior people. When the younger people start coming in, we felt like, the senior people had a market and, the younger
Yes.
people were quite discouraged from
Yeah, basically,
there.
yes, you actually got my question.
I think I thought I'm understood, but I think things have changed now. Okay?
Yes.
Because as I say, it's just simply the thing that the market, and partly because at that time the market was quite small, right?
Okay,
Especially
yes,
with the
yeah.
cosmetic surgery market, so
Yes.
they didn't want to lose their patient to the younger surgeons.
Yeah.
So they were very possessive and they would always look
very
down upon the
concerned,
younger
yes.
surgeon, make them feel low.
Yes, yes.
But nowadays, it's not
not
the
like
market is so vast now.
Gee.
And I think everybody will get a share of the pie because, and I think, my practice, my clientele is very different to another surgeon who must be practicing. And now because, I have obviously come through full cycle. I used to be able to do everything. I used to do noses, face, eye and everything. But then, as you go develop your practice, I think especially the type of practice in the UK is also breast-based.
Okay.
In England, I think 80% of my work is now breast surgery or anything, uplift, implants, all those type of things. So I got busy with so much of that, body contouring, faces and things. And I said, hang on, I can't be doing the noses, for example. So you know what I mean? You can specialize, you can super specialize now.
Yeah, exactly.
And because there's so many people around, so you don't need to do everything.
Everything, yes.
Yes, it's nice to have an experience of everything, but now you can just specialize. These are my best operation, and over the time which operation you can produce the best result, So you can stick with that, and there's a big market, so let other people do that, that different type of experience. So I think the market has changed, so I think everybody can be accommodated pretty much these days.
Alright, sir.
So that sort of jealousy in sort of some ways is sort of like dying down.
Alright, perfect. One more question that I have in my mind, I have so much in my mind when I'm talking to you because, you're such a powerhouse of education, mashallah. What I've been feeling in the past few weeks, patients out there, they come to you, they want a certain procedure, but they're very scared of cosmetic procedures. Basically, the surgical procedures. So, what do you think about this? Because people are actually very scared. Because when I tell them you are an ideal patient for a surgical case, a surgical procedure, so they refuse. They're like so scared.
No, I think this is absolutely true. I think that pretty much still, this is a subject which has been debated in all the big cosmetic surgery meetings. I think not just in Pakistan में specifically general anesthesia की वजह से लोग घबराते हैं ज़्यादा.
बिल्कुल सही कह रहे हैं.
UK, a lot of these hospitals, sometimes they don't have the right equipment and backup, and that's why I feel comfortable in KRISALYS that at least we've got the top end machines, anesthesia, and I tell my patient, God forbid anything happens, you are at the right place.
Yeah.
Yes, complications can happen as long as you're in the right setup. I think they should feel comfortable about it. But again, I think the discussion in all the big cosmetic surgery meeting, I think at the moment, they're literally only 1% of the people
who are getting it done.
Who are actually getting it done. 99% of the people are just not having it done for
just because of
some
fear.
unknown fears or something or the other. And that's what they say, how we can promote it to make it more comfortable for the patient to feel safer. So a lot of work is being done. But again, I personally don't push anybody.
Yeah.
Yes, I will educate them. I will be
Let
very
them know.
open, and I will tell them about the risk and complications, and and let the patient decide. I think they need to be comfortable. They can't be pushed into
They
it.
can't be pushed into it.
And again, it's that sort of like, shall I do surgery, non-cosmetic? I said that they're not substitute of each other. They supplement each other.
Yeah.
I think the surgical market has gone down compared because of the non-surgical. Because non-surgical you can do a lot of things now to at least delay the surgery.
Yes.
Inevitably they'll all need it. Things like threads and fillers and whatever. You can do a lot of these machines.
Now you have
there come a point at least they will need one.
Definitely. But what I've been seeing, Dr. Shahab, lately when I tell them, I can't fix this certain part of your face or the lower lid of the face with just a HIFU treatment or with a filler or with, like fetics or something. You need to go under the knife, But what I've been seeing in them, except the fair, they feel like the scar. The scar is a very big, a red flag for them.
Yes, absolutely. I think luckily, only 1% people have bad scars.
Okay.
And obviously that's what the cosmetic surgery, the plastic surgery, you can't avoid the scars, you can put them more strategically to try and hide them as much as possible.
Yes.
But luckily there are things available now. If it does happen, the scars do go wrong, with 1 in 100 people form a bad scar, 99% of them are great scars, but still there are a lot of things available now from the non-surgical which can actually help with that as well.
Alright.
So things are getting better.
Alright. And according to you as a cosmetic plastic surgeon, what is the role of good skincare products? Do you feel do they play a good role?
Yeah, exactly. That's what is going on about in the market is changing.
Yes.
The awareness is there. So
yes.
Really, and that's why patient ने जब मैं यार इतने अच्छे से करा रही हूँ ये non-surgical, मैं एक दफा facelift करा लूँ मुझे और भी खर्च करने की जरूरत है. No, you will need that.
Yeah.
Because that's not actually not in the load of surgery is this limited, but
yes.
you still need to maintain your skin. So I think that you just have, if you want to keep looking better, like it or not, you have to keep doing that.
Keep doing that. You need to incorporate good skincare products, and then you need to also do your skin boosters and everything like that if you want good results.
And exactly, that's where they need to sort of contact people like yourself, so you can just guide them to the right sort of products rather than just the marketing is one side, but I think we have so much professional obligation to the patient. I'm sure you know that.
Definitely, sir.
We give them the right advice.
Alright, sir. Thank you so much for being part of this podcast. I'm really thankful to you for giving us this much time, and I hope to see you very soon.
Absolutely, great pleasure, and inshallah we'll talk again at some point. Maybe we can do some more specific topics.
Definitely, inshallah.
Okay, this was about a general introduction.
Yeah, it was a very general introduction regarding KRISALYS and the cosmetic surgery field. We wanted Dr. Shahab to, break the stereotypes and certain questions which I usually get from my patients. Inshallah, in our next podcast, we will talk about different specific cosmetic plastic surgery procedures, and then we'll let you know very soon. Thank you so much for being a part of this podcast. Thank you, Ji. Allah Hafiz.
Allah Hafiz.